Hi everyone, it's Rebecca with linkinglewiscounty.com, and on today's episode of Hear All About It, we have Suzy Peck. Welcome, Suzy.
Thank you.
Suzy is a speech-language pathologist, and she's here to talk to us about all that entails. So, thanks for being here, Suzy.
Thank you.
Let's start with your training. How did you become a speech pathologist?
Yep. I went to SUNY Cortland. I got my undergraduate degree and my master's degree from there. So typically, speech pathologists have a master's degree, but it could also be a doctoral degree. I completed that in 2015, and I now work in a school setting, and I have been there for about 6 years.
Okay, so speech pathologists can work in the school system. Where else could they be?
Yep, we actually can work in a variety of settings. That's why I chose this career, because you can never get bored. You really can do a lot of different things. I started out in a nursing facility, actually, on the medical side of speech pathology. You can also do early intervention and preschool services, which we're going to talk about a little bit. You could work in an outpatient clinic or a rehab center. So there's a lot of different options, and we can work with the whole age continuum. We can work from birth to geriatric.
Okay, so I never really thought about it in this aspect. I was only just thinking of school children, but for the geriatric end or the medical end, you probably, when someone has a stroke, so they have to relearn those skills, and you do that. What are some of the ways you help them gain that back?
Yeah, so in the nursing facility, I worked with actually feeding and swallowing too, which is something that a lot of people don't know speech pathologists work with. So after a stroke or traumatic brain injury, sometimes that actually impacts swallowing. And it can actually happen just with aging as well. Or if you have cancer and have to have radiation, and it can impact those muscles. So there are actually exercises you can do to regain that. And you can actually do it preventatively as well. Before you get radiation, you can do the exercises to help strengthen those muscles so that they don't.
That's fascinating.
I know.
I had no idea about that.
Yes, a lot of people don't know we do that. But also we work with cognition for like short-term memory, attention, and like you were saying, we can work with apraxia or aphasia, which are speech disorders that can happen after a stroke. So, yeah. Okay,
so you really covered the spectrum. When it comes to working with students that you're currently working with now, first of all, how does someone, a parent or a caregiver, what do they need to look for to determine if a child needs some sort of speech therapy? Because it seems like all of them in the beginning kind of talk a little funny. So what should you be looking for when it comes to that?
If you don't mind, I'll talk about, so primarily in the school setting, I see a lot of speech and or language disorders. So I just want to cover kind of what the difference is, because a lot of people, when they think of a speech therapist, they think we work with like if a kid says wabbit for rabbit.
Absolutely, right.
That is something that we do work with, and primarily it's a large part of our caseload. But other than that, there's also language. So language can be receptive language and expressive language. So how you're understanding, like right now you're using your receptive language to listen to me and understand what I'm saying. As well as expressive. I'm using my expressive language to communicate. So that's another area that we work with in the school setting. So receptively, that can include like following directions, and I see that a lot with kindergartners. They'll come in and have difficulty following directions. Like if I said, put this paper on the table, they have to know what on means. They have to know what paper is. They have to have the attention to listen to that, and the short-term memory to recall what you said. So it's not only speaking the language that you're helping with, it's processing and interpreting what they need to do. So something to look for earlier childhood, they should be saying their first word around a year. That varies a little bit, but most children learn or go into stages around the same time. And then for 2 years, they should be combining 2 words together, and that's a big indicator of speech-language impairment. If they're not doing that, then that shows they're not progressing in their language. And then other than that, I lost my train of thought.
That's okay. Just talking about just talking about indicators when they're young would be 1 word by 1 year old. 2 words by 2 years old.
And combining then, 2 words, starting to form little phrases or sentences.
So if a parent or caregiver notices that that's not happening, what would be the first step that they would do?
Yeah, so if they're early intervention age, which would be 0 to 2,
Okay.
Actually, or preschool age 3 to 5, you can go right on to lewiscounty.org, I think it is, and
Okay.
it's a public health website, and on the left-hand side, there's a referral button you can click and just fill that out.
Okay.
And it's actually free of charge, the evaluation and therapy, as long as they qualify.
Okay.
So they would come do the evaluation and see if they qualify.
Yeah, and that therapy, if they were determined to need that therapy, that could be done at their home,
Yep.
at a daycare center, at a private home daycare.
Yep.
So they really work with the families to get that service going. If they start out in speech therapy, that's not necessarily, they don't continue on forever with that, right?
Yes. So really we prefer that we can get them in as early as possible. Because that's when we're going to see the most gains, and you really want to get speech therapy in before, so they can consolidate those language skills and then focus on their academics in schooling. So if you do notice red flags, it's great to get them in before school. So early intervention, preschool services, those are...
Okay, so there you could have an instance where a child has the early intervention, and by the time they make it to kindergarten, they're done with it.
Yes, correct.
But then there's the others that might not. So and that's the level that you're at currently, right?
Yep.
So what would be the services or what would you do as they become more like elementary age children?
Yep, so if they qualify for the IEP, it's called the Individualized Education Plan. That would continue into elementary, and we would just continue basically the goals that they were working on.
Okay.
Whether it was speech or language or fluency or whatever they had targeted as the areas of need, we'd basically continue that fluid document. And we also focus on the academic portion. So whatever they need to really thrive in the classroom and socially, emotionally, that would be what we would target.
Right. So I imagine then it's a combination of a lot of the teacher has to be involved, the parent has to be involved, you're involved. Do you feel like what is the percentage, or do you feel like a lot of kids receive this service?
Yes, I do. I mean, I think it's about 4% of the population,
really?
I believe, that has speech and language needs, but I have seen an increase with the COVID pandemic. I think just because of that lockdown, kids were a little more isolated and not exposed.
Not socializing, right, okay.
Right. So I have seen an increase in my caseload after that. But.
Okay. And I imagine also too, because of the increase of caseload, it's probably a little bit harder to meet the need right now, like everything else trying to catch up.
Yes, so if anybody wants to go for speech-language pathology, we definitely need it, especially in our area, but really all over. I mean,
and let's go over again the educational qualifications in case someone is interested in that.
So I have an undergraduate degree in communication sciences and disorders, but really you could start at a community college and get a general, which is what I did. I got a general education associate's degree.
Okay.
And then that can transfer over into a bachelor's, and then you need a 2-year master's after that.
Okay.
So it's a total of 6 years.
Okay. And is there different levels to the job where maybe you could be in the industry or the profession just with a 2-year degree?
No, not for speech pathology. We used to have speech therapists, which there are still some grandfathered in, but they don't have that anymore. That was a bachelor's degree. Okay. So now it is primarily master's degree, unless you already had that speech therapy kind of.
Okay.
Yeah.
Have we cut? Is there anything else that you want to go over?
I don't know. Yeah.
It's a very interesting topic, and
it's
obviously a lot more involved than I realized.
Yes. I did want to talk about some of the factors for speech-language delay. So all children develop at different rates, but there's a general guideline to follow, or timeline for speech and language development, where they need to meet certain milestones by a certain time. Some of the risk factors might be a family history of it. So it can run in the family. As many as 50 to 70% of children that have speech and language impairment have a family member who also have it. So if you had difficulty with speech and language, your child is more likely to.
Right.
So it's just something to keep an eye out for. If you know it runs in the family, just keep a watchful eye. And like I said, the evaluation's free, so if you were concerned, you just give them a call or go on the website and fill that out.
The evaluation is free and the service is free.
Yes, birth to 5, yeah.
Okay.
And then also recurring ear infections, because if they have that fluid in the ear, they're not hearing language, they need that exposure to pick language up. Hearing impairment, same thing, or oral impairment. Sometimes a tongue tie can affect that, so that's something to look for. Or cleft palate, cleft lip. Obviously, that would impact our speech.
Let's go over what a tongue tie is, because I recently just learned about that a few years ago. So there might be some people that don't know what that is. That is the little flap of skin.
Yes, underneath. Everybody has it, but some are tighter than others. So if it really impacts the movement of your tongue, it can impact speech. Not always, but sometimes it does.
And that's a pretty easy fix, right?
Yes. Yep. They just go to a pediatric dentist and they would essentially cut it.
Right.
There's really no downtime. It also can impact, like if your infant is having trouble feeding out of a bottle or breastfeeding, that can be because of a tongue tie, so that's something to look for too. I don't think a lot of people know that. Like if there's a bad latch and it's hurting when you're breastfeeding, it could be the tongue tie or lip tie.
Right.
So it's something to look for in your infant as well.
Right, okay.
So born premature or low birth weight could also be a risk factor. And like I said, lack of exposure and stimulation, that's really how children pick up language. A typical child just hears language and it's effortless. They just, unless they have a speech-language impairment, of course.
Right.
But if a child isn't exposed to a language-rich environment, if there's electronics on all the time, that will impact
Or like
speech
you said, with the pandemic, not going out as much, not having play dates. That's a big problem.
Yes, and exposure to technology now. I mean, everybody has their handheld device or whatever, so if that's on all the time and they're not interacting, language has to be interactive. They're not going to learn it off the TV. It has to be interactive with a human. So that's another thing that is linked to speech-language impairment. They have linked that. So. And then also your child could have apraxia of speech, meaning they have trouble coordinating their movements in their mouth to make speech sounds. It also could be linked to autism. Or, children develop at different rates. Sometimes it's unavoidable. It's just the way they're developing, and you've done everything. That happens as well.
So with did you say apraxia?
Yes.
Is it like on the geriatric end?
Yes, it can be both.
So in that, there's exercises for the young ones to do too, I'm assuming.
So apraxia can be acquired, meaning it happens after a stroke, or you can also be born with it. So there's two different types.
Okay.
But yes, so in the nursing facility, you would work with adults who maybe had a stroke. And so now they're having trouble coordinating their movements. Right. Or they could just be born that way. They'll be late talkers, have trouble saying their sounds.
Okay.
Yep.
Oh, this is fascinating. So I think we've covered it all. Do you feel comfortable?
Yeah.
We probably could talk forever, and we probably should have broke this down into a couple of interviews, but I think we're going to attach a file to this interview for people to, if they really want to get a visual of everything that we've been talking about, and there'll be information about how to contact if they feel like they need to get early services. This was very fascinating. I'm glad that you came in to talk about this, because obviously it covers the whole county and all age groups. So I really appreciate you coming in, Suzy.
Thank you for having me.
Thank you.